Beyond 50,000 emergency cases, I identified this pattern, and to be honest with you, it scares me. Not because the pattern itself is mysterious or complicated. It scares me because almost everyone misses it. Patients miss it, families miss it, and sometimes even doctors miss it. I am Dr. Narges, and this is HealthWise. Let me take you back to a moment I will never forget. It was a Tuesday afternoon in the emergency department. A woman, 72 years old, was brought in by her daughter. The daughter was worried, almost frantic. She told me her mother had been declining for about 8 months. Slowly at first, then faster. She was falling more often. She seemed confused sometimes, but not all the time. She had lost her appetite. She told her daughter she just felt old, like her body was giving up. The daughter had taken her to 2 different primary care doctors. They ran blood work. Everything came back normal for her age, so the doctor said what many doctors say when they cannot find a clear answer. She is getting older. And on paper, that made sense. She was 72. She had some arthritis, her blood pressure was well managed, her cholesterol was fine. But the daughter could not accept that answer, because she had watched her mother garden vigorously just a year earlier. She had watched her mother balance her own checkbook and cook Sunday dinners. And now, her mother was struggling to stand up from a chair. That is not aging, she told me. That is something else. And she was right. What I found in that woman's medication list changed how I look at routine checkups forever. She was taking 3 common medications, one for mild high blood pressure, one for occasional dizziness, which had started after she turned 65, and one for sleep. Her doctors had added these medications at different times, for different reasons, with what seemed like good intentions. But together, those 3 medications were creating a perfect storm. They were lowering her blood pressure just enough that every time she stood up quickly, her brain was not getting enough blood flow for a few seconds. That explained the falls. They were affecting her electrolytes in a way that caused muscle weakness and fatigue. That explained why she could not garden anymore. And the sleep medication, which she had been taking every night for years, was impairing her short-term memory and her balance. Not dramatically, just a little each day, enough that her brain was constantly working harder than it needed to. The daughter asked me something I will never forget. She said, "Dr. Narges, why did no one connect these dots?" And I did not have a good answer. Because the truth is, when you see patients separately, in 15-minute appointments, each medication looks reasonable. Each symptom looks like part of aging. No one was being careless, but no one was looking at the whole picture. Here is what I have learned from reviewing more than 50,000 emergency cases. Medication side effects in people over 50 are the most commonly missed mimic of aging. Not aging itself, the mimic of aging. And that is a critical distinction, because aging is not a disease. Aging does not cause a person to fall from standing to the floor repeatedly. Aging does not cause sudden confusion that comes and goes. Aging does not cause a person to lose the ability to walk to the mailbox. Those things are symptoms, and symptoms deserve explanations. But what happens in routine medical care is something I call symptom aging. A patient reports feeling tired, dizzy, weak, or forgetful. And because those things are common in older adults, they get dismissed as expected. But expected does not mean harmless, and common does not mean normal. So let me pause here and make a promise to you. By the end of this video, you will know exactly how to recognize this pattern in yourself or in someone you love. You will know the 3 medication categories that cause the most trouble. You will know what to ask your doctor, not to be difficult, to be informed. And you will know one simple, practical shift that can reverse this pattern completely in many cases. Not a miracle cure, not stopping your medications without medical advice. That would be dangerous. But a thoughtful, evidence-based approach that could change how you feel in ways you might have forgotten were possible. Stay with me. Because what I am about to share next might change how you see every medication bottle in your home. Let me tell you about the second patient who helped me see this pattern more clearly. He was 68 years old, a retired electrician, strong hands, sharp mind. At least, that is what his wife told me when they arrived in the emergency department late on a Friday night. She said he had been changing over the past year, slowly, insidiously. He was having trouble remembering names. He would walk into a room and forget why. He had stopped going to his monthly poker game because he felt embarrassed. He told his wife he thought he might be developing dementia. And his doctor, after a brief cognitive screen in the office, agreed. They scheduled a neurology consultation. They talked about memory clinics and brain scans. They even started a medication commonly used for Alzheimer's disease. But nothing changed. He did not get better. And he did not get worse in the way dementia typically progresses. He just felt off. His wife described it as him being present but not really there. So when they came to the emergency department after he had a sudden episode of feeling like the room was spinning, I did what I always do. I asked for a complete medication list. Not just the ones he remembered, not just the ones written by his primary doctor. Every single pill. And what I found changed everything. He was taking a medication for high blood pressure. A common one, a good one. Millions of people take it safely. But here is what his doctor had not considered. That medication can lower heart rate too much in some people, especially as they age. Not to a dangerous level, not to the point of fainting, just enough that his heart was not pumping as efficiently as it should. That meant his brain was getting slightly less oxygen with every beat. Not a crisis, just a slow, steady deprivation. Day after day, month after month. The result looked exactly like early dementia. Memory loss, confusion, brain fog, slowed thinking. But it was not dementia. It was a medication effect. And the most heartbreaking part? His doctor had added a second medication to help with some mild swelling in his ankles. That second medication was also affecting his electrolytes in a way that worsened the fatigue and the cognitive symptoms. And then, because he was feeling tired and dizzy, a third doctor had prescribed a medication for his inner ear, thinking the dizziness was a balance problem. That medication made him even more confused. So here was a man with 3 medications, each prescribed reasonably, each for a real symptom. But together, they were creating a cascade of side effects that had been mislabeled as aging, then as dementia, then as inevitable decline. None of it was inevitable. After we adjusted his medications safely, under supervision, something remarkable happened. Not overnight, but over about 6 weeks, his wife called my office. She was crying, not from sadness, from relief. She said, "He is back. He remembers our grandchildren's names again. He went to the hardware store by himself. He told me a joke last night. A real joke with a beginning, a middle, and an end. That is not a miracle. That is medicine done thoughtfully. That is a doctor asking not only what is wrong, but what might be causing what looks wrong. And that is the difference between treating age and treating the person who is aging." So here is what I need you to understand. When I say I identified a pattern across 50,000 emergency cases, I do not mean a rare genetic condition or an exotic disease. I mean something that happens every single day in homes and clinics across the country. A person over 50 starts feeling unwell, tired, a little dizzy when they stand. Their thinking feels slower. They lose their appetite. They fall once, then twice. And because all of these things happen gradually, they get normalized. The person says, "I am just getting older." The family says, "Mom is slowing down." The doctor says, "Your labs look good for your age." But here is the truth that no one tells you. Aging is not supposed to feel like a slow collapse. Aging is not supposed to make you afraid to stand up from your couch. Aging is not supposed to steal your ability to think clearly and hold a conversation. Those things are not aging. Those things are symptoms, and symptoms deserve to be investigated. Now, before we go any further, I want to be very clear about something. I am not telling you to stop taking your medications. That would be dangerous, and no responsible doctor would recommend that. What I am telling you is that medications have power. They have the power to heal, and they have the power to create new problems that look exactly like the problems they were meant to solve. The blood pressure medication that prevents a stroke can also make you feel tired. The medication that helps you sleep can also make you fall during the day. The medication that calms your anxiety can also slow your thinking. None of these are reasons to avoid medications. They are reasons to review them, regularly, thoughtfully, with a doctor who sees you as a whole person, not just a collection of prescriptions. And that is exactly what we are going to talk about next. Because once you understand which medications tend to cause these problems, and once you know the right questions to ask, you become an active participant in your own health, not a passive passenger. And that changes everything. Now let me share with you the 3 medication categories that cause the most trouble. I have seen this pattern repeat thousands of times across my career. And when I say trouble, I do not mean rare allergic reactions or unusual side effects. I mean the everyday, expected, documented effects of medications that are prescribed every single day to millions of people. The problem is not that these medications are bad. The problem is that their side effects perfectly mimic the symptoms we have been taught to call normal aging. And once you know what to look for, you will start seeing this pattern everywhere. The first category is blood pressure medications, specifically the ones that lower blood pressure by relaxing blood vessels or by reducing the heart's workload. These medications save lives. They prevent strokes, heart attacks, and kidney damage. I prescribe them myself when appropriate. But here is what many people do not realize. As we age, our blood pressure regulation system becomes less flexible. The body's ability to quickly adjust blood pressure when we stand up, or when we become mildly dehydrated, or after a meal, that ability naturally declines. So when you add a medication that lowers blood pressure even a small amount, the combination can lead to what doctors call orthostatic hypotension, a drop in blood pressure upon standing. Most people do not faint from this. They just feel woozy for a few seconds, or they feel like they need to hold on to something, or they feel unsteady on their feet. Over time, this leads to a fear of moving quickly. People start walking slower. They avoid stairs. They stop going for walks because it feels like too much effort. And because this happens gradually, no one connects it to the medication. They connect it to age. I have seen patients stop driving, stop socializing, stop living fully, all because of a blood pressure medication that could have been adjusted, reduced, or changed to a different class with a better side effect profile. Not stopped, adjusted. That is a critical distinction. The second category is medications that affect the brain's chemistry. This includes sleep aids, anti-anxiety medications, certain antidepressants, and medications for nerve pain. These drugs work by changing how brain cells communicate with each other. And in people under 50, the brain compensates beautifully. But as we age, the brain becomes more sensitive to these chemical changes. The same dose that helped a 45-year-old sleep well can cause confusion, daytime drowsiness, and memory problems in a 70-year-old. I have evaluated patients who were told they had mild cognitive impairment, early Alzheimer's, or vascular dementia. Their families were devastated. They were making plans for assisted living. And then we discovered they had been taking a common sleep medication every night for years. We slowly reduced the dose under medical supervision. We helped them find non-medication strategies for sleep, and within 2 months, their cognitive symptoms improved dramatically. They did not have dementia. They had a medication side effect that looked exactly like dementia. And here is the heartbreaking part. None of their previous doctors had asked about sleep medications. None had suggested trying a lower dose or taking a break. The assumption was always the same. The patient is older. Memory problems are expected. But memory problems are never expected. They are always worth investigating. The third category is a group of medications that affect balance and muscle function. These include muscle relaxants, certain bladder control medications, and some older antihistamines. These drugs can cause what doctors call anticholinergic effects. That is a complicated word for a simple problem. They block a natural chemical in the body that helps muscles contract properly, helps the brain stay alert, and helps the bladder empty completely. When these medications accumulate in an older adult's system, the result is constipation, dry mouth, blurry vision, confusion, and most importantly, falls. I have seen patients who were prescribed a bladder medication for urgency, a muscle relaxant for back pain, and an over-the-counter sleep aid that contained an antihistamine. 3 medications, all from different doctors, all for real symptoms. And together they created a fall risk so high that the patient could barely walk to the bathroom without holding the wall. When we stopped the unnecessary ones and found safer alternatives for the necessary ones, the patient stopped falling. Not because we did something heroic, because we did something basic. We looked at the whole picture. So here's what I want you to take away from this. If you or someone you love is over 60 and taking any medication for blood pressure, for sleep, for anxiety, for bladder control, for muscle pain, or for allergies, you owe it to yourself to have a medication review. Not a 5-minute conversation in a busy office, a real review. A thoughtful evaluation of whether each medication is still necessary, whether the dose is still appropriate, and whether there is a safer alternative. And if your doctor seems rushed or dismissive, ask politely but firmly. Could any of these medications be contributing to my fatigue, my dizziness, my memory problems, or my falls? That one question has changed more lives than almost any other I have taught my patients to ask. Because the answer is often yes, and that answer is the beginning of getting better. Not just managing symptoms, actually getting better. We are going to talk next about exactly how to have that conversation with your doctor, what to say, what to bring, and what to expect. Because knowing the pattern is one thing, acting on it is everything. Now I want to walk you through something that might feel uncomfortable to think about, but I need you to hear it because understanding this could protect you or someone you love. The pattern I have been describing does not happen because doctors are bad. It does not happen because pharmacists are careless. It happens because of how modern medicine is structured. Most doctors have 15 minutes per patient. In that time, they need to review past medical history, ask about new symptoms, perform an exam, update the record, order tests, and prescribe treatment. There is almost no time left to ask the big questions. Questions like, how do all these medications work together? Or, could this new symptom actually be caused by a medication the patient has been taking for years? Or, what would happen if we tried lowering this dose? Those questions require time. They require curiosity. They require a doctor who is willing to say, I do not know, but let me think about it. That is not the fault of any individual doctor. It is the fault of a system that prioritizes volume over depth, speed over thoughtfulness. And the people who pay the price for that system are patients over 60 who are told, over and over again, that feeling terrible is just part of getting older. Let me give you a specific example from my own practice. A woman in her late 70s was referred to me for what everyone thought was Parkinson's disease. She had a tremor in her right hand. Her walking had become slow and shuffling. Her face seemed less expressive than it used to be. She had seen a neurologist who started her on medication for Parkinson's, but the medication did not help. In fact, she felt worse. When I saw her, I asked the same question I always ask. Can you show me a complete list of every medication you take, including over-the-counter medications and supplements? She pulled out a bag. Not a list, a bag. Inside were 9 prescription bottles and 4 over-the-counter bottles. One of the over-the-counter medications was a common anti-nausea drug she had been taking for years because she felt queasy in the mornings. That anti-nausea medication is known to cause a condition that looks exactly like Parkinson's. Tremor, stiffness, slow movement, even the mask-like face. It is called drug-induced Parkinsonism, and it is fully reversible once the medication is stopped. She had been treated for the wrong condition for 2 years. 2 years of unnecessary medications, unnecessary worry, unnecessary decline. All because no one had asked about the anti-nausea pills she bought at the grocery store. After we safely stopped that medication under supervision, her tremor disappeared within 3 weeks. Her walk returned to normal. Her face became expressive again. She cried in my office, not from sadness, from relief. She said, "I thought I was dying. I thought my brain was failing, and all along it was a medication I did not even need." This is why I am making this video, not to scare you, to empower you, because the difference between suffering through this pattern and breaking free from it is often just one thing: awareness. Once you know that medication side effects can mimic aging, you stop accepting every symptom as inevitable. You start asking questions, and those questions lead to answers. Those answers lead to changes, and those changes can lead to a quality of life you may have thought was lost forever. But here's where it gets even more important. The pattern does not only affect older adults who are already frail. I have seen this in people in their early 60s who are still working, still active, still trying to live full lives. A 63-year-old man who was told his fatigue was just middle age. He was taking a common blood pressure medication and a statin for cholesterol. Both were appropriate. Both were helping him. But the combination was causing muscle aches and fatigue that he had accepted as normal. When we switched his blood pressure medication to a different class and adjusted his statin dose, he told me he felt 10 years younger. He started walking 2 miles a day again. He went back to playing golf. He told me he had forgotten what it felt like to wake up with energy. And he had accepted feeling terrible for 3 years because 3 different doctors told him his labs were fine. His labs were fine. His quality of life was not fine. And that is the gap that routine medical care often misses. Labs tell us about organs. They do not tell us about living. So let me give you a practical framework for thinking about your own medications or the medications of someone you care for. I call it the annual medication audit. Just like you would review your finances or your home safety once a year, you should review your medications once a year with a doctor who is willing to spend time on it. During that audit, you want to ask 4 specific questions. First, is every medication I am taking still necessary? Sometimes medications are started for a temporary problem but never stopped. Second, is every medication at the lowest effective dose? Often the dose that worked at age 50 is more than necessary at age 70. Third, could any of my symptoms be side effects rather than new medical problems? This is the question that gets missed most often. And fourth, are there non-medication alternatives I could try for any of my conditions? Lifestyle changes, physical therapy, dietary adjustments, better sleep habits? These approaches often work as well as medications for certain problems, without the side effects. These questions are not meant to make you distrust your doctor. They are meant to make you a better partner in your own care. A doctor who welcomes these questions is a doctor worth keeping. A doctor who dismisses them is a doctor who may not have time to see the whole picture. And you deserve a doctor who sees the whole picture. In the next part, I am going to tell you exactly how to have this conversation, the exact words to use, the exact information to bring, and what to do if you meet resistance. Because knowing what to ask is powerful. Knowing how to ask it changes everything. Let me teach you exactly how to have the medication conversation with your doctor. Not the rushed version, the real version. Because I have sat on both sides of this conversation thousands of times. As a doctor, I know what I am looking for. As a patient advocate, I know what works. And the difference between a conversation that changes nothing and a conversation that changes everything is usually just a few carefully chosen words. First, preparation matters more than almost anything else. Before your appointment, write down every single medication you take. And when I say every single medication, I mean every single one. Prescription medications from every doctor you see, over-the-counter pain relievers, antacids, allergy medications, sleep aids, and cold remedies. vitamins, minerals, and herbal supplements, eye drops, nasal sprays, creams, and ointments that are absorbed through the skin. Anything you put into or onto your body that has a pharmacological effect. Put them all in one list. Include the name, the dose, how often you take it, and how long you have been taking it. Put that list in a bag and bring the actual bottles if possible, because labels tell the full story in ways that memory cannot. I cannot tell you how many times a patient has told me they take one blood pressure pill, and then I look in their bag and see 3 different blood pressure medications from 3 different doctors. That is not lying. That is just how fragmented modern medical care has become. And that fragmentation is exactly what allows dangerous patterns to develop. Second, bring a written list of your symptoms, not just the ones that bother you most. Every change you have noticed in the past year. Fatigue, dizziness when you stand up, memory lapses, trouble sleeping, falling or feeling unsteady, loss of appetite, muscle weakness, feeling sad or anxious, difficulty concentrating. Write them down exactly as you experience them, and include when each symptom started. Was it before a particular medication was added? After? Did it get worse when a dose was increased? This timeline is gold. It is the closest thing we have to a clue in a mystery where the culprit often hides in plain sight. Now here is the most important part, the actual conversation. Do not walk into the appointment and say, "I think my medications are causing problems." Some doctors will hear that as criticism or as you practicing medicine without a license. Instead, say this: "I have been noticing some changes in how I feel, and I would really appreciate your help understanding whether my medications could be playing a role." That phrasing does something powerful. It invites the doctor to be your partner rather than putting them on the defensive. It shows respect for their expertise while also asserting your own experience of your body. Almost every good doctor will respond well to this approach. And if a doctor does not respond well, if they dismiss you or rush you or tell you that your symptoms are just aging without any investigation, that is information too. That tells you that this doctor may not have the time or the curiosity to help you with this problem, and you deserve someone who does. During the conversation, ask these specific questions. Could any of my medications be causing fatigue or dizziness? Those 2 symptoms are the most commonly missed side effects in older adults. Could any of my medications interact with each other in a way that affects my thinking or my balance? Many drug interactions do not cause dramatic emergencies. They cause slow, steady decline that gets labeled as aging. And finally, would you be willing to help me try reducing or stopping one medication at a time to see if my symptoms improve? This is the most important question, because the only way to know for sure whether a medication is causing a problem is to do a careful, supervised trial of a lower dose or a different medication. Not stopping everything at once. That would be dangerous. But a thoughtful, step-by-step exploration, one medication at a time, over weeks or months, with clear tracking of symptoms before, during, and after the change. This is how real medical detective work is done, slowly, carefully, respectfully of the fact that medications save lives every single day. Now let me tell you what to expect after you have this conversation. A good doctor will take you seriously. They may order some tests to rule out other causes of your symptoms. They may check your blood pressure sitting and standing to look for that drop I mentioned earlier. They may check your kidney function, because many medications are processed through the kidneys, and changes in kidney function as we age can cause medications to build up to higher levels than intended. They may ask you to keep a symptom diary for a few weeks. All of this is good. It means they are being thorough. Then, if everything looks appropriate, they may suggest adjusting one medication, lowering the dose, switching to a different medication in the same class, or, if the original reason for the medication is no longer present, stopping it entirely. This process takes time. It requires patience. But I have seen it transform lives more reliably than almost any other medical intervention I offer. Because when you remove something that was harming you, the body has an extraordinary ability to heal. Not always completely, not always quickly, but often beautifully. One more thing before we move to the final part. If you are helping an older parent or a spouse with this process, your role is invaluable. Older adults often minimize their symptoms. They do not want to be a burden. They have been told so many times that their problems are just age that they stop reporting them altogether. So you can help by observing, writing down what you see, gently advocating during appointments, and most importantly, reminding them that they deserve to feel as well as possible at every age. Aging is not a disease, and feeling terrible is not a requirement. In the final part of this video, I am going to give you that practical insight I promised at the beginning. The one simple shift that can interrupt this pattern. Not a complicated protocol, not expensive testing, just one thing you can start doing today. And I am going to tell you exactly how to do it. Now I am going to give you that practical insight I promised at the very beginning. The one simple shift that can interrupt this pattern. And I want you to hear this clearly, because it is the most important thing I have learned from reviewing more than 50,000 emergency cases. The shift is this: stop accepting vague symptoms as normal aging. That sounds simple, almost too simple. But let me explain what I really mean. Accepting vague symptoms as normal aging is not just a passive act. It is the single greatest contributor to the pattern I have been describing. Every single patient I told you about today, the woman with the falls, the man who thought he had dementia, the woman who was told she had Parkinson's, every single one of them had been told at some point that their symptoms were just age. And every single one of them had accepted that answer. Not because they were weak or uninformed, because they trusted their doctors. And because our culture has taught us that aging is a disease, a slow decline, a loss of function that cannot be stopped or reversed. That is not true. Aging is a biological process. It comes with changes, but it does not come with falling, with confusion, with losing the ability to walk to the mailbox, with feeling so tired you cannot enjoy your grandchildren. Those things are not age, they are symptoms, and symptoms deserve investigation. So here's what I want you to do. Starting today, I want you to change one word in your internal vocabulary. Stop saying, "I am just getting older." Start saying, "This is a symptom. I do not know what is causing it yet, but I am going to find out." That shift, from acceptance to curiosity, is the most powerful medical intervention I know. It costs nothing, it has no side effects, and it changes everything. Because once you stop accepting vague symptoms as normal, you start asking questions. You start keeping track. You start bringing that list to your doctor. You start having the conversation I just taught you. And that conversation leads to discoveries. Sometimes the discovery is that a medication needs to be adjusted. Sometimes it is that a vitamin level is low. Sometimes it is that a sleep problem is actually a breathing problem. Sometimes it is that what looked like dementia is actually depression. And sometimes, yes, sometimes the discovery is that the symptom is truly age-related and nothing can be done. But here is what I have learned after 50,000 cases. That last scenario is far less common than most people believe. Most of the time, something can be done. Not a cure, not a miracle, but an improvement. Sometimes a small improvement, sometimes a life-changing improvement. And you will never know which one it could be unless you stop accepting and start asking. Let me give you a specific example of how this works in real life. A man in his early 70s came to see me. He had been told by 3 different doctors that his fatigue was just age. He was taking no medications, his labs were normal, his physical exam was normal. On paper, he was healthy, but he felt terrible. He could barely make it through the afternoon without a nap. He had stopped going on walks with his wife. He was falling asleep after dinner every night. He told me he felt like he was living at half speed, and he had accepted it. He said, "I guess this is what 70 feels like." But I asked him one question no one had asked before. "What do you eat in a typical day?" And he told me, toast and coffee for breakfast, a sandwich for lunch, pasta or rice with chicken for dinner, almost no vegetables, almost no fruit, almost no beans or lentils or nuts. He was not deficient in anything on standard lab tests, but his diet was causing slow, steady inflammation and unstable blood sugar that made him feel exhausted all day. We did not add a medication. We changed his breakfast: protein, healthy fat, and fiber instead of toast. Within 2 weeks, he told me he felt like a different person. He was not just getting older, he was getting inadequate nutrition. And because he had stopped accepting vague symptoms as normal, because he had come to see me curious rather than resigned, he got his life back. Not a miracle, a change in breakfast. So here is my final message to you. You are going to age. Every single one of us is. That is not the question. The question is how you age. Do you age passively, accepting every new ache, every new foggy thought, every new limitation as inevitable? Or do you age actively, with curiosity, with questions, with a willingness to say, "This does not feel right, and I am going to figure out why"? The patients I have seen who age best, the ones who are still gardening at 85, still playing cards at 90, still living independently, they are not the ones with perfect genes or unlimited resources. They are the ones who never stopped asking why. Why am I tired? Why am I dizzy? Why is my thinking slower? And they are the ones who found doctors willing to ask those questions with them. That is the pattern I have seen across 50,000 emergency cases. Not a pattern of disease, a pattern of disengagement. And the antidote is not a new medication or a fancy test. The antidote is your own curiosity, your own refusal to accept feeling terrible as normal, your own commitment to keep asking, keep learning, keep advocating for yourself and the people you love. Thank you for spending this time with me. If this video made you think differently about your health or the health of someone you care for, I would be honored if you would subscribe to Healthwise with Dr. Narges. Every week, I share insights like this one. Not quick fixes, not fear-based warnings, just thoughtful, evidence-informed conversations about how to age well, prevent what can be prevented, and live fully at every age. Take care of yourself, and keep asking why.